For my therapy session, I would need items for a game that I'd be playing with them, which is called Can I Take Your Order? So each of them would have a little tray in front of them, and I'd make enough copies for all three of them. In the game, there's different pieces that are food items that they put on their tray. All of these food items have our words in them. So they'd have plenty of different options to look at and choose from. And that's what I need for my therapy session. I'm also going to be using some visual cueing with my hands, which I'll talk about. And for easier purposes, just so you can follow along a little bit easier, I'm going to say that Jimmy is the boy working on receptive language, Bob is the boy working on his R sound, and Dylan is working on strategies to help him with his stutter. So to start off this session, I would first give them reminders to each of them. I would tell Jimmy, who is working on his receptive language, that we will be working on listening to questions, and we'll be listening to those questions to help us understand what is being said. We will also be working on responding to those questions. And then I would move on to Bob, who is working on his R sounds, and I would tell him that we're working on his R sounds in all positions during this therapy session. And I would say, let's try to make a few good R sounds together by growling like a bear. So, grrr, grrr. And then I would say, now let's roar like a lion. Rawr, rawr. And then I would say, now let's bark like a dog. Ruff, ruff. So really just practicing those R sounds. And then I would also be doing this visual cue. Roar, roar. So he knows to put his tongue back and up. And then I would remind Dylan, who is working on techniques to help his stutter, that he can use cancellation by pausing and redoing the word if necessary. I'd also remind him that we can use the stretching technique. So I would say, let's try a word together. The word that we're going to try is rice. So rice. And I'd use that visual cue of stretching out that sound. And then if he wanted to do the cancellation by going rice, he could. Then I'd explain the game. So I'd be saying, we're going to play a game called Can I Take Your Order? Each of you will have your trays in front of you. And when I say my order, you need to grab the food items that I'm requesting. I will call out 3 items for you to put on your tray, so you need to be listening carefully. After that, I will ask one of you to tell me what you put on your tray, and we can see if you were listening to my request. So then I would say, for the first round, I would like to order rice, ravioli, and corn. And then I would ask them, I would say, okay, can I see what you put on your trays? And then I would call on one of them. So for example, I'd call on Bob first, who is working on his R sound. And hopefully he would say rice, ravioli, and corn. And then if he did them correctly, I'd say, like, nice job with your R sounds. Remember that your tongue is going to go above the back of the teeth to make that R sound. Err. And then the next round, I might say, I would like to order broccoli, raisins, and gravy. And then I would say, okay, and like, let's take a look at your trays. And then I might call on Dylan, who's working on those techniques with stuttering. And I would say, Dylan, can you tell me what you put on your tray? And hopefully you would say raisins, broccoli, gravy, things like that, using those techniques and cancellation and things. And then I would just, again, remind him that we can talk nice and slow, and then we can stretch those sounds out. So getting practice doing that. Then I might move on to Jimmy, ask what he put on his tray, and hopefully if he was listening correctly, if he didn't hear, he wasn't using those receptive language skills, I might say, let's go back and listen one more time. And then he'd be using expressive language skills by answering my question and telling me what was on his tray. And that is how I would incorporate all 3 of the kids in one therapy session.